The most important first step is to cool the burn. And ideally this would be done with a cool, clean water source. But if there isn't clean water available, even using something like the dog's water bowl is better than not cooling the burn at all. Don't worry about germs. The burn can be cleaned later. And I would recommend avoiding ice because it can worsen the injury. So the burn should be cooled for at least a minute, but longer is also fine. And even if blisters are appearing, the burn should continue to be cooled. So the caregiver should keep the child warm. In the case of very small burn injuries, less than the size of a loonie, it's appropriate to keep the child at home, and a Band-Aid and some antibiotic ointment such as polysporin can be applied. If the child is experiencing pain, which they often are with these injuries, an over-the-counter pain medication such as Tylenol or Advil is appropriate. In the case of larger burns, covering the burn with a clean dry sheet and calling 911 is the best course of action. So when the burn injury is greater than the size of a loonie, when the burn involves sensitive areas such as the face, hands, feet, or the diaper area, if there's many blisters that are forming, if the child is experiencing significant pain, but most importantly, when in doubt, seek medical attention. So when a child comes into the hospital with a burn injury, they'll receive pain medications to keep them comfortable. The burned areas will be cleaned and a dressing applied. And in most cases, children can go home and come back to have outpatient dressing changes over the next few weeks. Some children will need to stay in hospital, and some children will benefit from a surgery for their burn injuries.